Hygea, Inpatient Department, IPD Complete Workflow Demo. There are two common scenarios for admitting a patient. First, the patient directly visits the hospital for admission. Second, the patient is admitted based on the doctor's recommendation after an outpatient consultation. In both scenarios, the admission process begins with the receptionist. The receptionist navigates to the front office workspace. If the patient is visiting the hospital for the first time, the receptionist first creates a new patient record by clicking the Register Patient button and entering the required details. Once the patient has been registered, click the Admit button. Here select the appropriate bed, assign the admitting consultant, choose the preferred ward, verify the bed charges, and complete any remaining admission details. After entering all the required information, click Admit. A success notification will confirm that the patient has been admitted successfully. Immediately after admission, the selected bed status is automatically updated from available to occupied. The admitted patient's record is now available to the nursing department. The nurse navigates to the nursing workspace, where they can manage ward rounds, drug rounds, nursing notes, and patient observations. To record the patient's vital signs and clinical observations, open the patient record, click Observations, enter the required details, and save the record. The triage board is used to manage emergency and critical patients who require immediate medical attention. The OPD queue displays all patients waiting for consultation, organized by their assigned token numbers. The Hospital Command Center provides a comprehensive dashboard that displays hospital operations along with key financial information, including total collections, outstanding balances, bed occupancy, and other operational insights. During the patient's stay, the doctor can visit the patient, review their condition, prescribe medications, and record clinical notes. To do this, the doctor navigates to the doctor workspace, opens the Notes section, enters the required observations or treatment notes, and clicks Save Note. A confirmation notification will appear, indicating that the patient's clinical notes have been saved. Recorded successfully. Once the patient's treatment is complete and they are ready for discharge, the final step is to complete the discharge formalities. Before discharge, all pending hospital charges must be cleared. The billing counter executive navigates to the billing workspace, searches for the patient's record, and reviews the outstanding balance. Any unpaid amount is clearly displayed in red. Please note that the Clear and Discharge button remains disabled until all outstanding dues have been paid. After receiving the payment, the patient's outstanding balance is automatically updated to 0, and the patient's status changes to Cleared for Discharge. The billing executive can verify that all dues have been settled by reopening the patient's billing record. Finally, click Clear and Discharge. A confirmation notification will appear, indicating that the patient has been discharged successfully. If required, click Print Invoice to generate and download the patient's final invoice. At the same time, the previously occupied bed is automatically released and its status changes back to available, making it ready for the next patient. This completes the complete inbound patient IPD workflow in Hygea.